Welcome to Leadership Beyond Burnout. I'm your host, Dr. Kimberly L. Wilson, and welcome to another episode. Today we have Dr. Jason Studley. Welcome.
Thank you. I appreciate you having me here.
Oh, absolutely. It is a pleasure, and I love that your specialty is in rural hospital care because I don't think people understand how important it is in rural communities because it is vital. I've personally lived in a rural community, and coming from an urban environment, the lack of resources in those communities is just amazing. So to not have a hospital can be devastating. Can you share your passion about rural hospital care?
Absolutely. One of the things I think the benefits that actually came out of the COVID pandemic had to be with our safety net system. So a lot of people refer to them as rural hospitals. They're also known as the safety net hospital system because when we have some kind of a global pandemic, such as we did with COVID, the urban hospitals were overrun. They were shutting down. They were limiting access into the hospitals. That's where the safety net kicked in. That's where our rural hospitals that sometimes people think are in a sleepy community or anything like that have well-trained staff, physicians, nurses that are used to working with less resources. So they're very diligent about making sure that they're able to provide that care. So when the urban markets and COVID shut down, here in Mississippi, you had the major players in Jackson and down in the Gulf Coast. The major hospital systems could no longer take patients. And so what they did is they shipped patients out to the rural hospitals. So the majority of my hospital that we had in the Delta was actually full of patients from the Jackson and the Gulf Coast areas because of that. So as a safety net hospital, we had a full 9-bed ICU. We expanded an additional 9 beds. So we became an 18-bed capacity ICU caring for COVID patients. And that would not have happened without having these rural hospitals in place. And we have a lot of training that goes on a continual basis for any kind of major disasters that happen because the urban markets can get overwhelmed very quickly. And as we saw during the pandemic, for example, all the nursing shortages and the radiation technology shortages, all these shortages where the nurses were leaving the areas and they were going to even urban hospitals where they were having to rely on patient staffing ratios that they weren't used to. All of a sudden they're going from having, mandated 1 in 4 patient care to doing a 1 in 6. Well, rural health nurses know what that is. 1 in 6 is an easy day. All right. So they were able to roll up their sleeves and help provide the care to our communities that we really needed and that we had to have, as well as open up to other hospitals or other communities across our state in order to provide that care. So from a rural hospital perspective, that is where I spent my career. That's where I focused my career. I started off as recruiting physicians to rural markets and learning what it was that motivated physicians to want to choose to practice in a rural market versus an urban market.
Right.
And so from there, I built my career off of those, building those relationships, helping to understand the draw to the rural markets. And the more I learned of why other people chose the rural markets, the more I built my career off of wanting to be in those rural markets.
Wow, you just said a mouthful, and I have so many questions just off of that. I think I want to start with first. I think that there is a misconception for just the average consumer that a rural hospital means substandard care or not the best care, and they want to be. And you just brought in the fact that they know how to do more with less, and there's greater opportunities for training and practice and community. And I'd love for you to, do you believe that that's the public perception as well, or no?
It can be the public perception, but every market I've worked in, I've worked in several markets in several different states. Every market I've worked in, take Georgia, for example, um, the people who had a rural hospital in a rural community, they wanted their family to go to Augusta because it had better care. But the people in Augusta wanted to go to Atlanta because it was better care. Well,
Right.
here's the grand scheme of things. Every one of those nurses, every one of those physicians, they all went to school together. All right. So it's a
Good
matter
point.
of where you want. So the training itself, they have the same amount of training. The experience they have when you go to higher urban markets, what you're going to find is more subspecialty care. You're not going to have a general practitioner who's going to know you. All right. They're
Hmm.
not going to know you because you come in and you see them and you get your regular, semi-annual checkups with them on a regular basis. When you go to larger markets such as Atlanta, you're going to be a patient number XYZ. Here's your medical record. They're going
Right.
to read over it 5 minutes before walking in the room and having a conversation. Whereas in more of a rural setting, you're going to know your doctor because you see the same person on a regular basis. Plus, you run
Right.
into them at Walmart, you run into them at the grocery store. They're going to know more about you, and they're going to have a better sense of commitment to your care from
Right.
that perspective. On
Right.
top of it, there's also the statistic that physicians who actually are in medical school and have a part of their program is where they rotate out to
Right.
a rural market. 85 of the percent of the physicians that rotate out to a rural market will end up setting up practice within 100 miles of that location.
Hmm.
So it is a preferred because for the motivation for physicians, nurses, radiation technologists, everything is in a rural market. They're allowed to practice the full scope of their license. Whereas when you get into a larger urban market, you subspecialty, you're limited on what your practice of scope can be. So you may be an MD in an urban market where you're doing not cardiology, you're doing interventional cardiology, and you can't do invasive anymore. You can't do cardiothoracic. But if you go to a rural market, you have a cardiologist who can go, invasive, maybe even interventional within that market because they've been trained, they have those skills, and they're regularly practicing those skills in that market, so they can practice to the full extent of their license.
Right. And then they don't get rusty because
Right.
they can
Yep.
practice the full breadth. And I'd imagine that also when you mentioned one of the things that you learned what attracts doctors and nurses to those rural communities. And I'm wondering if a big part of that is the fact that it is so intimate and it's safer and there's less stress in those markets.
I would not necessarily go so far as to say there's less stress, but it's a different type of stress, and it's a different type of a lifestyle that seems to appeal to physicians that choose that market. More so than it's not just treating the patients; they get to know their patients on an intimate level. But from a community standpoint, they get more involved in the community. They're able to influence political happenings in the community, such as getting involved with city council, getting involved with the county supervisors. They have more of an influence and more of a platform and a podium in order to influence change for the positive. And so
Wow.
in rural communities, you see a lot of physicians hands on with identifying and addressing, different aspects of healthcare that may be difficult, such as the cost of medications.
Mm,
The American Heart Walk in rural communities, you're going to find a big outpouring of actual physicians participating in the walk and not just community leaders out there for photo ops. You're going to see people actually taking participation in it because it means something to them in their community to get their community educated and aware of this. And so the physicians that have the appeal to the rural communities, it's normally because of it's a greater lifestyle. They want to build a place for their family to
right.
thrive. And so you'll see a high percentage of multi-generational physicians living in rural markets because they have built that foundation within the community that's where they want to raise their families.
Right. So they it almost in essentially become physician advocates.
Yes, yes, absolutely. The
Wow.
best recruiting tool into a rural market are the physicians you have there. They call up their
Right.
schoolmates and say, "Hey, you got to come check out this place."
Right.
And it's like I said, a lot of places it's multi-generational.
Right. And I'm even thinking about parts of my career when I was in rural markets for mental health care. And just as you mentioned, now that I think about it, I was on the domestic violence committee and I was on that committee. And I knew the sheriff and I knew the people at the hospital staff. I was very integrated into the community, and we were able to get more done because there was more of a relationship than a bureaucracy.
Absolutely, absolutely. Especially when hospitals moving more toward value-based purchasing and the compensation models for how everybody's getting um, being reimbursed into the near future, the rural markets, you're going to see a quicker shift because the physicians know the social determinants of health and they're already advocating for the communities to take proactive approaches to it. So
Right.
they're actually going to be able to make that shift a lot faster than the urban markets who are going to be relying on pay per transaction.
Mhm.
So it's going to become more of an opportunity for um, smaller, more intimate communities with physician and nurse leaders being in the community and being proactive with it. You're going to see better improvements in health on a quicker basis than what you could see in larger urban markets where it takes a lot longer in order to get those I guess pedals in motion.
Right. And it even seems like they'll be able to take more of an advantage of those social determinants of health and not be placed, um, for physicians to be able to heal themselves. Because I feel like oftentimes medical, mental health, they're placed in situations and circumstances, work environments where they can't even take care of themselves adequately or even be a part of their family's lives.
Right. No, absolutely. And in other communities, you're going to see when physicians begin to get wore down, especially during COVID. I mean, we had a tremendous, a lot of other, especially our pulmonologists. There was a heavy burden, a heavy workload placed on them.
Right.
And you saw an outpouring from the community. I mean, the community in my community here that I'm in, I mean, they came out, they decorated the outside of the hospital parking lot, thanking our heroes. Thank you to the doctors. I mean, it's those little things like that where the community just showed a little more, respect, a little bit of love for the doctors that kept
Right.
them going for that entire year. And so it kept them engaged, kept them moving forward. And so it was one of those things where, I mean, we had to be able to pivot on a moment's notice. I mean, we're masking today, we're not masking tomorrow, and we kept having to make those shifts, but we didn't get yelled at from the community. We got, you guys are doing everything you can.
Right.
And that right there is because of the relationships prior to the pandemic hitting. Those relationships had been built already at that point over time. And so it was just one of those things where, you do what's right today, tomorrow the community is going to have your back.
That is so beautiful, and I'm sure that packed so much more of a punch than any financial compensation for working over or doing anything, to just have the grateful hearts of a community surround and bless you, and it just embeds you more into the community.
It does. It really does. And so a lot of the same times, I mean, from a mental health standpoint, physicians need to be able to collaborate with other physicians. They need to be able to have that safe space to where they can open up to one another because they're going to have more of an understanding of what they're going through and have more of that. And in rural environments where there's more of a relationship built, they really are their neighbors. They are literally each other's. They're treating their other family members.
Hmm.
So it's not their family members, but they're going to their partner's family members, and that kind of a level of trust and build up right there. I think from a mental health standpoint helps physicians in more rural markets actually be able to cope with and handle the stressors of their jobs and continue moving forward. And it's not just physicians. I mean, nursing staff. I mean, there's a tremendous a lot of pressure on them. And just, but like I said, there are patients that they're treating today. They're treating very well. They're going to run into them at Walmart. They're going to run into them at the grocery store. They're going to see them, and they're going to get an unsolicited thank you in the middle of public because that's how much the communities actually care for them and able to take them forward. So I think that helps a lot with them realizing and remembering their why.
Right.
A lot of times
I
people
was
will forget.
just thinking the same thing, that it probably keeps them embedded and
Yep.
entrenched in their why,
Yes.
whether whereas if you are in a more urban market, it's probably a very distant memory, because I don't think I've ever seen a time where I've seen doctors becoming coaches because
Right.
they can't do it anymore. It's just too much on them.
Yep. Absolutely. Absolutely. I would agree with that. And I mean, from my perspective and what I've talked to a lot of my medical staff, my nursing staff, my frontline staff, is you've got to be able to do self care as well. I mean, it's vital. It's important for yourself to be able to move through. I mean, when the pandemic, when it was in the full throes and everything was just starting to open back up, we could start, you know, getting out a little more. For healthcare workers, we got to go every day. We didn't know what a lockdown was, all right, because we were out and out
Right.
and about. But one of the things, you know, I encourage others to do, and I did myself, was I hired a fitness coach.
Mm,
And it's like, you know, I've got to have self care as well. And I hired a fitness coach, you know, and he helped me through a plan on my nutrition, helped me, you know, how to deal with stress, how to get adequate sleep, water intake, and created a fitness program for me that I could do at home because the gyms were closed down. And so he created an at-home workout plan for me that I worked for a year until the gyms open back up and I get back into the gym. And then he revamped my program. But it's one of those things where I would encourage others to do the same thing, because no matter with all this stuff that is going on, you have to have some kind of a plan for yourself to keep yourself, you know, mentally, spiritually, physically focused and available in order to continue moving forward.
you're absolutely right, and it's interesting. I just remember, it's like, wow, I did the same thing. That's when I was getting up every morning at 5 o'clock to
Yeah.
join my group on. We actually had a group on Zoom that led
Nice.
by a fitness coach, and every I still can't believe that I got up and then he made us walk or run after our
Yes.
hour. I I still I still can't believe all the things that I did in terms of self care and the way my life transformed just by going through the pandemic and having that luxury. And I do remember that portion of being able to drive the streets without traffic.
Right. Right.
It was so much fun. It felt like you were in a little private movie. It's like, where are all the cars?
Yes. Yeah. It was definitely something a little bit different, and it's one of those things where you need to challenge yourself every day. Just as I always say, I mean, I carve out time for physical fitness. I carve out time for additional education every day. I read at least 30 minutes a day, just something. And it doesn't have to be in my industry. It can be something completely off the wall.
Hmm.
I study all kinds of different areas of interest for me, and it has nothing to do with it other than it's just a matter of continue to expand your mind and look at things in a new perspective.
Right.
So I think a lot of those, most of my recommendations that I've gotten for those have been from some of my physicians, because there's a lot of interest out there that they have that's outside of medicine. And so one of them had me studying the stars and starting to learn about the different types of stars and quasars and white stars and novas. And I can't even remember all of them. It was well above my head. So I should have started with a little more of a beginner's guide to this astronomical studies. um,
Sixth grade science.
Absolutely, absolutely. But just different areas of that. I mean, get into photography, find a hobby, some kind of an outlet. I can tell you there's a hospital I worked at here several years ago. We had the entire pediatric floor with these most beautiful landscape photos, and they were blown up, and they just covered all the way down the entire hallway of this pediatrician wing. And come to find out, it was a hobby of an OBGYN to do this photography and donated all of the photos in order to decorate the new PEDS unit. And they were just gorgeous. But this was a side hobby, but another contribution that they were able to make. And it was just something they did as a hobby, but it kept them mentally sharp, mentally focused, and got them away from 100% medicine all the time.
Yes, that's beautiful. And that's actually one of the things that I've recommended to clients before, that just you forget how healing nature can be. Now those are just photos, but when you actually go out and you take off your shoes and you
Yeah.
connect with the earth, you smell the air, you actually look at the things that you pass up every day in detail, it is a romance song.
Yes. Yep.
It's like
Absolutely.
I love that. What I'm curious, what do you feel like are some of the unique challenges that some of the leaders and staff experience in the medical community regarding burnout?
Um, Even though it's more of a tight knit, closer type of a community, I still think that there's a stigma around speaking out about mental health. I'm feeling burnout, or I'm feeling stressed out. I still think there's a stigma that surrounds that, even in the smaller communities, and maybe even more so. I mean, kind of think of it, because it may be, we may know each other a little too well for me to tell you that I'm struggling, or
Mhm.
my title means I can't tell people, I'm the CEO. I'm not supposed to tell people, hey, I don't know what we're going to do next. Let's just, hope for the best. I can't say
Right.
that to people, but there's a stigma around. It's like, I don't always have the right answers.
Mhm.
Um, so I think with that stigma also, too, when it relates to burnout, is just a matter of, you've got to find your person. You've got to find that someone that you can confide in, and that you can, share the burdens. No, don't hand off your burdens, but you
Right.
want someone that you could share those burdens with. Because a lot of times when we say something out loud, it's almost therapeutic, and it's almost
True.
as if you're talking to yourself. You're getting those thoughts that are crammed and running all different directions inside your head and colliding with one another, and you're getting them out of your head, and you're freeing up space for more clear thoughts in there. I think a lot of people do journaling,
Mhm.
and it's just that you get all these thoughts out of your head, you journal it down. That way they're out, and you have more space for that. So I think a lot of it, from a in the leadership standpoint in hospitals right now, is we've got to find that person.
Mhm.
There's programs that most hospitals offer, to the staff and everything, like EAP clubs, and you can have a
Yes.
couple of contacts, with counselors and things of that nature. And um, I, I'll be the first to admit, I've used it. All
Good.
right, I've taken advantage of it, and hey, I'm dealing with some stress. This is, what I'm going through, and this is what I'm facing, and it was beneficial. It was helpful, and it was somebody I don't even know, somewhere else across the country. But it was
Right.
just a matter of being able to verbalize it and get it out. It actually helped me get through that stressful situation, and be able to move forward. And I would encourage our employees to use those type of benefits that they have, or like I said, find your person, find somebody outside of work, that you share common interest with, that you may be a volunteer at the local library or something, and build up a relationship with somebody there, and you be
Right.
able to actually share your burden with them. Like I said, once again, you're not giving them your burden; it's your burden, but you're sharing it out loud, and it's almost, self-therapeutic. And just to have somebody else hear it, it just they don't always provide the best advice because they don't know the full story, but it's just nice to have somebody be there to be able to say, okay, I hear what you're saying. I have had similar situation.
Right.
And it's like, okay, I'm not the only one that's gone through this. Okay, this is good.
Right. Eh, You're absolutely right. I've definitely seen that coming up as a clinician. Many times people do create their own solutions, and they're so thankful to me, and I just listened. I
Yeah.
was just the vessel sometimes to hear what's going on for you, and you're right, they're able to sort through some of their thoughts just by releasing some of that. I also encourage people sometimes that if they are concerned about sharing something with someone and how that experience is going to go, ask the person. Let them know what you need from them.
Wow, if I would have known that in the first 5 years of my marriage, the next 20 would have been much easier. It took me a while to figure that out, but that would have been great advice at the beginning.
Oh, that is funny. There is this great YouTube clip called, and don't forget this, it's called It's Not About the Nail.
It's not about the nail.
It's not about the nail. And it's I think it's like 2 minutes and 13 seconds. But if there was ever something that demonstrated male and female dynamics, that is it. So, Dr. Jason, what do you think if you had the opportunity to lead a just forward thinking healthcare community that really was going to be on the leading edge of taking care of their healthcare community and delivering awesome outcomes, awesome patient outcomes, what would be some of the things that you would implement?
Oh, man. You're speaking my vision now. Here we go. All right. If I could redesign the healthcare for a community, the first thing I would do is throw out the hub and spoke model. Okay. Healthcare cannot be centered around patients coming to the hospital. All right. When chronic conditions turn acute, patients show up to the hospital. That means we as healthcare providers failed them somewhere along their journey. They should be able to manage their chronic care conditions outside of a hospital and acute care setting. So ideally, we need to be able to implement technology. All right. We need telemedicine services. We need a shared approach around meeting patients where they are at home. We need, for those that can't get care in their homes, we need to have mobile units, or we need to have some type of a primary care based within neighborhoods to where they can go to quick access for care and be able to manage their conditions. We need cheaper pharmacy medications. All right. It's ridiculous how much the drugs are costing. And then you've got these PBMs built on top of it where don't get me started on where that money's even going. All right. Because it's not coming back to the hospitals. It's not coming back to the healthcare providers. The shared savings is going somewhere.
Right.
All right. So it's a matter of the system is broke, but if we want to fix it, we've got to redefine and get away from the hub and spoke. Entire states are trying to build their healthcare model off of a hub and spoke, saying, okay, here's our main hospitals in the main city. All you rural hospitals, all you do is triage and send them here. All right, you're missing the point. There's better care there. So the statistic I last saw that was when a hospital closes within a 25-mile radius of that hospital, the death rate increases by 6%. 25 miles, a 6% increase in the death rate.
Man.
So that's really difficult to comprehend, but it doesn't have to be, a level 1 trauma center in every single city that we have. But what you do need is a level to meet the needs of that particular community. They may need urgent care. They may need a standalone ER department just to take care of, farming accidents and things of that nature. They may not need, open heart surgery if it's, elective procedure that can be scheduled and done, at another time. But what they do need is primary care. Physicians in every market, in every neighborhood, there should be some type of a primary care system set up. And a lot of this can be
almost like a neighborhood Walmarts, but
yes,
for healthcare.
Absolutely. And technology based. Because we've got the technology now. I can grab my phone and I can click a button and I can talk to a physician wherever I am in the world. Right? A couple of years ago, we were on vacation. We were down in Florida. I was based in Virginia at the time. My daughter had a rash. I clicked a button. I'm talking to a doctor in Virginia that's part of my system. He's videoing. He's looking at the rash. He's calling it into the local pharmacy of where I am. I'm not paying a copay. I'm not having to pay anything because it's part of my plan. That's the technology we have. I could have went to Florida. I could have went to an urgent care center. I could have, paid the $75 plus had them file my insurance plus had to pay all this other kind of stuff. But we have the technology. I had my local physician group who I knew, who knew my daughter, who had her records on with a click of a button. That's the type of technology we have. but we've got to build out the basis of it. I've been in markets where they don't have broadband. They don't have the capabilities to run a telemedicine program because nobody has internet in their house. Believe it or not, here in the U.S., we have that problem. They had it in Virginia. They have it in Mississippi. I mean, it really is an issue that we don't have the capability. We have the technology, but we don't have the ability to roll it out yet to these rural communities.
You are absolutely correct. I remember in my former mother-in-law's home before she passed, my cell phone would not work in the house, but if I stepped outside X amount of feet and just in the right spot,
Right. Right. Absolutely.
I could use my cell phone. So, I mean, it was great for me shutting down at the end of the day and not needing to be connected to work because I truly couldn't even get phone calls.
Oh, yeah. And I kid you not, it has been within the last 3 weeks. I have wired internet. I could not have done this call 3 weeks ago in my own home because it was all done by satellite. So it's just been within 3 weeks that they just finally rolled cable out here to my neighborhood that I could attach to it.
Wow.
Yeah.
Oh my goodness. Okay. Yeah, I forget about those times. It's now I'm also curious if because you stimulated my thinking when you were talking about using technology, and I'm sitting. Oh, my watch is charging. We've heard stories before of how iWatches save people's lives. So when you talk about that level of connecting to technology, do you even mean to the point where the medical community could tap into some of these iWatches and different things we now use to monitor our health that are commercial, or are they not up to the standard of providing medical data?
I would say yes, as a cautionary or as an opt-in measure.
Okay.
Because here's the issue: if I have my iPhone, I look at my health data, I monitor it myself. I do those things because I'm interested in what's going on with it. I will tell my doctor about it when I go to see him.
Okay.
But because of liability, they don't want to have to monitor my watch on a daily basis. So they're not going to want that downloaded into the medical record because they don't have the staff to monitor all their patients' data coming in. We have a data overload. Where we're going to have help with that is AI. That is going to be the future of taking all this data that we have coming at us from our watches, from our smartphones, from all these different devices, and the AI technology is going to be able to process that data and actually be able to take it and actually put it down to something that is meaningful and usable that we can actually measure results against. Right now, with all the data we collected from CMS, all the medical records, if you print out somebody's medical record for a 15-minute visit with their physician, there's going to be 22, 23 pages of worthless information that the doctors don't want because they don't know what to do with it. It's just pages and pages of data because we don't know how to handle the big data yet.
Okay.
AI, I am hopeful, is going to be able to help us process that data and make it usable for us because right now we're just collecting.
To be able to synthesize it into something that's meaningful. Okay.
But for individuals, by all means, I would say track your data. Take control of your personal health and watch your data on a daily basis. I mean, my fitness coach, he sits down and he says, we're going to do an average, your weekly average on everything. Every one of your measures, what's your weekly average? Because daily, it's going to vary. All right. Even your weight goes up and down 3 or 4 pounds on a daily basis. But at the end of the week, what was your average? And then we're going to track your data with your average. And then every couple of weeks, do we need to make an adjustment? I think people need to take that kind of a commitment on their own personal health. And these tools that we have from the iWatches, those kind of things, they're great tools to keep us focused. But we need to go back to have a regular physician checkups. Every 6 months or something like that and say, hey, doc, this is what I've got. Draw my labs, Am I on track? Am I not on track? And, just have that regular checkup with your primary care physician, but take some control for your own health. I mean, you own your health. And I think these are great tools to use to help guide us, but we shouldn't be making decisions based off of the level of data we're getting at this point in time. My personal opinion. I'm not trying to endorse anybody.
Right. Absolutely. And you've also got me now thinking about the opposite of an innovative hospital. And what do you feel like is the impact? Because I love that you started out as a clerk. What do you think is the impact on the staff at multiple levels in a hospital that has created a sick system where burnout is the norm?
Yeah. Once again, I still think we're battling the stigma around it. There's so much difficulty about speaking out about it. I mean, we need more platforms like you have on a personal basis for, I mean, we need something we can go to our staff and say, hey, look, here's a YouTube channel. Why don't you guys check this out on your own time and get them thinking about it, get it become a norm, get it to be useful. I mean, we need to be talking about it at board meetings. We need to be talking about it at staff meetings. We need to have some kind of a platform that we can go out and I got to tell you, it's going to have to come from the leadership. I mean, if I'm standing in front of my staff, I'm going to need to be able to talk to them about this is a real thing and we're concerned for you. Don't blow this off. You need to do it. But if it's not coming from the top, everyone's going to think they're the only ones it's happening to. But if it's coming from the top, all of a sudden, okay, wait, this is a genuine concern for my well-being. This is not another, hey, look, here's an added benefit. Go just, use the EAP benefits, but don't tell me about it. No,
Right.
It's encouraging them. It's really encouraging. This is a benefit. This is something that's here for you, for your well-being. And people need to hear that to get past the stigma. Even behavioral health, I've had behavioral health centers, that I've run. There's still a stigma within the behavioral health unit. And that's something that I just think it needs to be a little more educational. Now, mind you, I grew up in the old school, guys, we don't talk about our feelings. We don't cry. We suck it up and we move on.
Right. With a big old straw.
Absolutely. Absolutely. We don't express our feelings in front of our wife and our kids. They expect us to be strong. Now, to a degree, yeah, I still have that, I still filter my emotions and everything through that type of mindset. But at the same time, there's levels of mental health, behavioral health. We still need that personal touch. We're still called to be social creatures. And, it's one of those things where you just touch someone on the shoulder, grab them by the elbow, shake their hand. You have that 5-second touch and connect with somebody. That right there has so much to do with mental health.
Right.
And just making that connection that you're like, look, let's be encouraging to one another. I don't know what you're going through. I don't know what life experiences you're filtering, everything that's coming in at you, all the data you're bringing in. I don't know what you're filtering it through because I don't know your experiences. Right. But look, I'm here too, and we just need to get past that stigma of, everybody needs to suck it up, buttercup. No, you need to address it and face it.
Right. And I would also add to that, now that you're saying that, to redefine what that vulnerability means, because it's being paired with weakness and ineffectiveness and all of those things. But sometimes when we lay down our burdens momentarily, it allows us to run further faster because we've unburdened ourselves. We've emptied our pack, and we can support someone else because we've taken care of ourselves.
That's right. And the key to that is never picking it back up. Once you lay it down, you leave it. It's there. It's done. It's no longer you.
So, and don't pick up other people's.
That's right. That's right. Reiterate that. You can share your burden with me. I'm not taking it for you.
That's right. And I think so many times when you have people in the human services professions and they do care about others and their well being, they tend to take on too much and want to overprotect,
Yep. Yep.
enable people so that they no longer are even, it's no longer their burden. They take on that responsibility.
Right. Right. And it's difficult. And like I said, I've worked in very highly impoverished areas, and I've witnessed a lot of mindsets generationally that,
Yes.
okay, as soon as I'm of age, I can get on this government assistance rather than I want to do something different and those kind of things. But it's generational, but it's
Yes.
nobody's ever stopped and told them you don't have to.
Right.
There is another way. All right. I was raised in a very poor family. I'm a Medicaid kid. All right. I grew up on food stamps. I had a single mom, and it's just, we lived in a trailer. I mean, I'm like, that whole story,
Hmm.
but nobody ever told me I couldn't do it differently. Nobody ever told me you couldn't work hard. All right. It's one of those things where I had the drive to continue moving forward, and I broke those generational curses on my family.
Right.
And so now we're striving forward. But it's one of the things where you've got to have these outreaches. And once again, this goes back to a rural community and how close knit we are. I can
Right.
go to these people and that I meet, and I can, put my hand on their shoulder. I can work beside them, volunteering, at the local food bank or something like that. And I can
Right.
touch them and I can talk to them on a daily basis. And it's like, there's more in you. And just the look on their face, like no one's ever told me that before. It's like, oh man, that just breaks my heart, but it's true. But there's only so much of yourself you can also give before you begin, like you said, to try to take those burdens on yourself.
Right.
And there's
Right.
got to be a level of care there as well.
So it's as if you're saying that when the leadership comes down and shows some of that vulnerability and shares there's a different way and you don't have to be uh, Teflon or have all this armor up. There's time to care for yourself. There's time to care for others. There's time to care for ourselves as a community, that it
Yep.
becomes strengthened.
It does, and it has to be a priority. It's
Mm,
not that there's a time, there's a season. It needs to be on your calendar. This is my mental time. This is the time where I sit back and reflect. I journal. I do whatever. This is my prayer time. This is my time to connect spiritually. This is my physical fitness time. I'm going to be at the gym. All right. You've got to plan those times, put them on your calendar, and keep those appointments like it's a doctor's appointment. All right. These appointments are important because even if I take, 20% of my day and I divide it up and say, okay, this is, physical fitness, this is spiritual, this is mental. Okay. I've got my family time here. I've got my work life here. I can take 20% of my day out and I can be more productive in the other 80% than what I could if I didn't take that other 20 for myself.
right,
All right. I can get 2 days worth done in 80% of one day.
right. You're absolutely right. I can't tell you the number of people that I've seen over my career uh, with regrets and confusion because their family no longer is interested in them because they spent the bulk of their life focused on their career and didn't
Right.
engage with their family, didn't take care of their spirituality, and then they're wondering why they're now alone.
Yep.
And it's the saddest thing to when you get that realization, because you can't get that time back.
Yep. Nope. That's absolutely right. And I'll tell you what, when I show up to the gym in the mornings, I mean, the other gym patrons that are there on a daily basis will ask me where my wife and daughter are because they come to the gym with me. All right, we all go together. We
Wow.
all my son's away at school, so that's why he's not going right now. But I walk into the gym alone, and they're like, "Whoa, whoa, whoa! What are you doing here? Where's the rest of
Oh,
the family?" So it's one of those things where even my personal time, my physical time, can also be spent together with my family. If
Wow.
it's something healthy for all of us, it's something we could do together. And my wife and I can teach our daughter what it means to make it a priority in her life. So when she
Wow.
goes off to college, that will be a priority for her as well, to take care of herself physically, mentally, and continue moving forward.
Wow. That's beautiful. I think I actually do it in the opposite way, because when I've taken my family, for me, I'm still like a mother henning everybody and trying to correct, and it was just like, okay, this is not working for me, because
Yeah.
I'm not doing what I need to do. And I'm just like, wow, you haven't been on there very long. Why are you taking a break? It's like, okay. So I need a little more work before I can do that. Maybe I can do that once a week or so.
Well, I like I said, I outsourced it to my fitness coach, and I've got my wife. She's got her own plan with him now, and my daughter. So he's the one that gets to yell at them if they're not doing right, not me. We just
Oh,
go
okay. So
together.
you all are on the family plan. That's a
Oh,
great idea.
oh yes, absolutely, absolutely. Because I can't come in and say, "Hey, look, my meal's got to be different than yours today," because my wife's not cooking 3 different meals. All right, so it's one of those things where we're all agreeing, we're all coming together. So it's like we get this number of calories per day. Here's our macros. Everybody fend for themselves. And my wife's like, this is what's for dinner. You plan your other meals throughout the day around what we're having for dinner as together as a family. So
Wow.
it works for us.
That is beautiful. That would even be a great benefit for families, and you talk about EAP benefits. Here's your family wellness plan. Oh my goodness. They've
Yeah.
got a fitness instructor and dietitian and whatever going on. That would be beautiful.
Yeah. Yeah. My fitness coach, that's actually his full-time job. And he works in the UAE, the Bank of United
Arab
Emirates.
Emirates?
Yeah. UAE, UE. He's in Dubai. All right.
Yes.
But he runs the wellness program for their entire banking system that they have there. And that's what he
Okay.
does. I mean, he sets up these plans for the employees and families. And I think it's a brilliant idea. I wish we
That
had more
is.
of those here in the US.
That would be wonderful. That is taking care of your people and ensuring that they have quality of life, not just they show up to work every day and do their job like they're supposed to do.
Right, right. Absolutely. And it increases productivity. I mean, I can tell you, and self confidence.
Have you ever had any personal experience with burnout to why you're now very intentional about taking care of yourself? Was it pre-pandemic or during the pandemic?
Oh, yes. Yes. No, I would say I was on the verge of burnout when I had a takeover for one of the hospitals I was managing. The company I was working for did a spinoff to another company, and my hospital was one of the ones included in that. And part of the spinoff was to sell off my hospital.
Mm,
And because it was profitable, we were doing very well, and they had a large debt load because of the spinoff, and so they were having to try to get rid of some of their debt, and so they had sold my hospital. It was a very stressful time for me. I had never been through anything of that nature. Since then, I've been consulting and actually working in hospitals that are going through those types of transitions to get them through it
right.
after what I had learned. But the original time was highly stressful. I'd never been on the verge of unemployed before. And so it was one of those things to where I was facing a lot of uncertainty, personally, professionally, all those kind of things.
Right.
That's why I knew that I needed to have that release for myself. And that's why I started hiring my own personal coaches to
Mhm.
get me through those times and to be able to rely on them. I've got professional coaches. I've got mentors for myself. I have mentees that rely on me. So everything that I've been given, I give back. And
Right.
I hired my fitness coach. And I mean, it's those things where you learn in life when you go through those types of situations, you find out what you did not know. You look
Mm,
back and said, okay, this is how I handled it. How could it have been better? How can I
right.
have been a better husband? How can I have been a better boss? How could I have been a better dad? if something like this ever happens again. And what you learn is you've got to find those people who have done it right or who have done it really wrong and learned how to do it right. All right. So they say, I think it was Mark Twain said, good judgment comes from experience. Experience comes from bad judgment. I have a lot of good judgment built up in me now. Okay. So, but absolutely. But you've got to be able to reach out. You've got to be able to find those experts. I mean, you've got, people like you who are, speaking out, and you have these platforms about burnout, and you probably know more about it than anybody else.
Right.
And it just has to be to a point where myself as an executive, I've got to be able to sit back and say, okay, I don't know, but I do not have a problem reaching out to those people who do know and learning from them.
Yes.
And so it's one of those things where we have to get past our own egos. My ego's been crushed years ago. All right. So I don't hardly have any much of an ego left. But what I do have is a network that I surround myself with people that are way smarter than I am. Right. But I know them and I know what they know enough to be able to reach out and say, help me understand this better. Picture this, frame this around our relationship because you know how I think. All right. So, help me understand what it is that I need to know about burnout. So I don't go through it again, because right. I don't want to go through it again. I need help with my medical staff because talking to my medical staff is different than talking to my executive team.
Right.
Talk to me about how I can talk to my frontline staff because that's a lot of things that people don't really talk about a lot. Is, like you mentioned, I started off as an ER registration clerk. I mean, during my time in college, we were burning through ER registration clerks. I mean, they were going through, and I was getting promoted a lot because I was the only person left. All right. But we were running through it. But a lot of times you don't think about the frontline staff and the burnout that they're getting as well.
They're dealing directly with the public.
Directly with the public. And let's face it, people don't show up to an ER and usually in the best mood of their life.
Right.
All right. They're not happy-go-lucky. Something's wrong. They're not feeling good. They couldn't get in to see their doctor who they love and trust. And so they're going to come and hear, and they're typically not in a good mood when they come in.
Absolutely.
And they're dealing with them on a regular basis. But I wouldn't know how to go in there and say, hey, look, let's work on burnout with you all. Make sure you're happy. You've got to have that connection. Now, for one chance, I can actually go to my employees and say, look, I started off as an ER registration clerk, and I've worked my way up to CEO.
Right.
All right. I've done that. So I can actually go back and tell them that. I don't go back and tell them I could do their job today.
Get up, I can do this.
Yeah, no, that ain't happening, But
you're like, I don't want that kind of stress anymore.
No. I'd much rather, I'd much rather be the CEO than actually have to deal with the front line, So
yeah. And what was it Kaiser Permanente that they had 79,000 walkout?
Yes.
That is mind-boggling.
It is. But I mean, Kaiser has a good model, but it doesn't vary by community. So it's one standard model, no matter where they are. If you're part of their, and it's a good model. Don't get me wrong. It's a very good model. But once again, I'm a rural guy. I'm a community focused. In communities, there's ways of getting things done within the culture of the community.
Right.
Now, if you don't like the culture of the community, you begin to change it from the inside and you influence. But you can't come in and say, here's the model we're going to do from now on, moving forward. It's got to be a slow process and something that you implement, or else before you get the burnout, you're going to get the walkout. And that was a major issue.
Oh, I love that phrase. Before you get to burn, you're going to get the walkout. Yep. I love that. I know in my husband's community, I found out the power in a rural community. He had a 80, 90-year-old grandmother, and they had been there for multiple generations. As a matter of fact, the movie A House Divided with Jennifer Beal was made about their family. And if you wanted something done, if you couldn't make it happen on your own, you just said, Grandma. and And she knew the family.
Yep.
You didn't have to worry about tickets. You don't have to worry about taxes. You can get an extension, whatever it is. She had the power
That's right. That's right.
because she either babysitted, knew somebody's mama, daddy, something. It was amazing to watch. I had never seen anything like that.
It it really is. In a lot of communities, they all have their different way of doing it, but there's always that one person or that one family who has the influence, and they really do have the community at heart.
Yes.
Figure out how to get in with them, and you can get things done. So,
Beautiful.
it's a culture, and that's something I think you've alluded to, in quite a few of your other videos and things like that. It's a mind shift that you actually have to be able to focus in on. But as leaders, going forward, it's burnout has to be one of the topics that we talk about more, but also that we're aware of and we're focused in on identifying in our staff, in our physician, in our frontline staff. When I'm walking up and down the hallways, I mean, if I get within 10 feet of somebody and they don't, acknowledge that there's other people in the hallway, that should be a clear sign to us that there's something going on with them or with the department that needs to be addressed.
Any last words that you want to share with our listeners?
No, it's been a tremendous career that I've had. I've been in hospital administration now for over 25 years. I'm looking forward to the next 25. Here's what I'm hearing a lot of, and a lot of my colleagues, and I've shared this with you, prior to our interview, but I've had several of my colleagues who have said, we've had enough. They're done. They're retiring or they're switching industries completely. Right. And this is what I want to say to everybody else that's still out there in healthcare right now is this is a pivotal moment in how healthcare is going to be delivered into the future. All right. We are on the brink of being able to redefine healthcare delivery. We're being able to redesign the system itself. We have all these new technologies coming in. I mean, telemedicine, AI. We have it is a new frontier, and so the old ways of things are going to go away, and we get to redefine how it's going to be done in the future. So this should be an exciting time for us in healthcare, and all these newcomers that are coming up. Like I said, I've got all these new mentees coming up, and they want to be healthcare executives. They're a level of excitement. I'm excited about this next generation that's coming in to take over this healthcare industry. I mean, everybody should be excited because they're coming in, they're smarter, they're well prepared, and they're eager to jump in and create the new system. And I just think this should be an exciting time. So for us seasoned guys, we need to stick through it. We need to help mentor them and get them to the next level before we decide to bow out ourselves.
So to be a student of that which is about to come to fruition.
Yes, absolutely. Absolutely.
Well, I thank you so very much for being here. And until next time, if you'd love to come back, I'd love to have you come back if you ever want to come back.
Certainly. I think this has been fun.
All right. So. Thank you. Thank you, everyone, for tuning in to Leadership Beyond Burnout. I'm your host, Dr. Kimberly L. Wilson. I'm here every Thursday, 5 p.m. Eastern Standard Time, 2 p.m. Pacific. And until next time.